Imagine your eye is like a smoke alarm. If it suddenly starts blaring, you do not waste time arguing about batteries. You look for the fire. Papilledema is like that alarm. It is swelling where the optic nerve enters the back of your eye, and it can be a sign that pressure inside your skull is too high. And when the pressure in your head is rising, the cause can be serious. In this video, we are going to talk about papilledema, what it feels like, what causes it, how doctors confirm it, and how it is treated. If you ever hear this word in an eye exam, the main takeaway is simple. This is not a wait and see situation. Papilledema itself is something an eye doctor sees, but you can feel the effects of the pressure behind it. A lot of people get headaches, often worse in the morning or when coughing or straining, because that can briefly raise head pressure even more. Some people notice short episodes where their vision goes dim or grey for a few seconds, especially when standing up quickly, and then it clears. You might also notice blurry vision, trouble seeing clearly off to the side, or moments where your vision just feels off, but you cannot explain why. There can be other clues too. Nausea, vomiting, and a whooshing sound in the ear that matches your heartbeat can happen when pressure is elevated. And sometimes the scariest part is that early papilledema may not wreck your vision right away, so people feel tempted to ignore it. That is exactly why it is dangerous. Papilledema happens because pressure inside the skull is elevated, and that pressure is transmitted along the optic nerve. Think of the optic nerve like a cable running from your eye to your brain, wrapped in a sleeve. When pressure rises, it can squeeze that cable where it plugs into the eye, and the tissue swells. So what raises pressure in the head? One cause is a mass, like a brain tumor, which takes up space. Another is a blockage of normal fluid flow, like hydrocephalus, which is basically too much cerebrospinal fluid building up. Infections and inflammation in the brain and its coverings, like meningitis, can also raise pressure. Blood clots in the veins that drain the brain, called cerebral venous sinus thrombosis, are another cause doctors worry about because they can be life-threatening. There is also a condition called idiopathic intracranial hypertension. Idiopathic is a fancy way of saying we do not find a clear cause. Intracranial means inside the skull. Hypertension means high pressure. This is one of the more common reasons otherwise healthy adults develop papilledema, and it is often associated with weight gain, especially in women of childbearing age, although it can happen in other people too. Papilledema is usually first suspected during a dilated eye exam when the optic nerve looks swollen. But doctors have to be careful because other things can mimic it, like optic disc drusen, which is basically buried deposits that can make the nerve look raised even when skull pressure is normal. If papilledema is truly suspected, the next step is urgent evaluation to find the cause of the high pressure. In many cases that means brain imaging, often an MRI, which is magnetic resonance imaging, and sometimes an MRV, which looks at the veins, to rule out masses and venous clots. This matters because doing the wrong test first can be dangerous. For example, a lumbar puncture, also called a spinal tap, can help measure the pressure and test the fluid, but it is typically done only after imaging shows it is safe. Eye testing also helps track damage. Visual field testing checks your side vision, which can be affected early. Optical coherence tomography, often called OCT, is like an ultrasound with light that measures swelling and nerve fiber thickness. The overall goal of diagnosis is twofold. Confirm that the swelling is real papilledema, and then identify why the pressure is elevated. Treatment depends on the cause, because papilledema is a sign, not the root problem. If a mass is present, the focus is on treating that, which may involve neurosurgery or oncology. If infection is the cause, it is treated with urgent targeted medications. If a venous clot is the cause, specialists treat the clot to restore drainage and reduce pressure. When idiopathic intracranial hypertension is the cause, treatment usually aims to lower pressure and protect vision. Weight loss is often a big part of improving the condition. A common medication is acetazolamide, which helps reduce cerebrospinal fluid production and can improve papilledema and visual outcomes in many patients. If vision is worsening despite medical treatment, some people need procedures to relieve pressure more directly. No matter the cause, the priority is the same. Protect the optic nerve before swelling turns into permanent damage. If you have symptoms like sudden vision dimming, severe headache with visual changes, or you are told you might have papilledema, Treat it like an emergency and get evaluated right away. If you found this video helpful, consider subscribing and checking out the next video.